I want to thank everybody for being here today to another Brown Bag Lunch presentation. And I want to welcome you to a program offered by the Osher Lifelong Institute where learning should never end. I want to first start off by acknowledging that Cal Poly Humboldt is on the land of the Biak people, which includes the Biak tribe, the Bear River Rancheria, and the Blue Lake Rancheria. I want to acknowledge the history of the people who live here and their contributions to caretaking of the land and just being stewards of the land for so many years. And I want to encourage us all to learn about the history of their culture and knowledge.
Maybe. Start showing right on this.
I wanted to show this little image on the side because it kind of showcases how you can use the raise hand function on Zoom during this presentation. You can go ahead and ask questions as you have them, but we ask that you put them in the chat or use the raise hand option. Or you can also wait for the end to ask them, but if you have a burning question, you can go ahead and ask them. Some upcoming OLLI classes that we have. This last Saturday, we had the Eureka Island, which is a history class taught by Jerry Rhodey. We have another one coming up on Saturday, May 21st. But in between them, we have a few animation classes, Enneagram Part 2, and Explorando Culturas con Isabel Allende, which is going to be a bilingual class taught by a Chilean professor who has a PhD from Samoa. I want to thank our friends of OLLI who make these programs possible. Because of their support and contributions that we can offer these free resources to the community. So I want to thank you. I also want to remind OLLI members that the library is not open and you can stop by or get an ID, or you can also do it online and you can use all of their resources. I also want to thank all of our volunteers also who help us plan our curriculums for the next semester. It helps a lot and keeps us in touch with the community really neat. So if you're looking to be a volunteer, you can send us an email and we can add you to our team. But before further ado, I'm going to pass it off to Jane so she can introduce our instructors for today.
Hi, and welcome to you all. And we have a wealth of speakers today. We have Lynn McKenna, who is a retired teacher. She's been with the WAC committee for 6 years and is the current advocacy chair. She's passionate about providing resources and information about Alzheimer's to our community and is a member of the #1 Visiting Angels WAC team in the nation. Kim Coelho holds a BA in journalism from HSU, now Cal Poly Humboldt, and an MS in community health from Austin Peay State University. She worked for the American Cancer Society for 15 years as a health educator and fundraiser. She now works for the Alzheimer's Association as a community engagement manager. And last but not least is Nora Shepard, who has a BS in biology and a master's of public health degree. She was a coordinator of the Healthy Brain Initiative in Shasta County and served on the Reading Walk Committee. She now lives in Trinidad and is an advocacy volunteer with the Alzheimer's Association. Welcome to all three of you, and I'll turn it loose to the three of you. And perhaps we should mention, by the way, that there are some computer issues that they've suffered, and hopefully it won't be a problem. Thanks so much. It's all yours. Lynn, you're muted.
Unmute.
Okay, am I muted now?
Yep, we can.
Okay, we're trying to get this to work. This is, there they are.
Just when you think all the computer challenges have been fixed, then they pop up again, and there you go. Very frustrating, isn't it?
All right,
Advance the slides.
can you see that?
Not yet. You want to go back to Zoom and share screen again, maybe?
Okay.
How do I get out of this?
Let's see.
Can you share screen?
Okay, all right. Sorry, everybody. The computer is not liking any of us today. So we're here today, welcome, and we're here today to talk to you a little bit about the Alzheimer's Association, some of the different things that are happening in the association, some ongoing research to educate you a little bit about Alzheimer's and to answer any questions that you might have. So the Alzheimer's vision is a world with, or the Alzheimer's Association's vision is a world without Alzheimer's and all other forms of dementia. Their mission statement says, the Alzheimer's Association leads the way to end Alzheimer's and all other dementia by accelerating global research, driving risk reduction and early detection, and maximizing quality care and support. So the first thing we're going to do is the Alzheimer's Association has, if you want to grab those, they can't see those. When we do our walks across the country and on all of our posters and media releases, we have Promise Garden flowers. And the Promise Garden flowers are 4 different colors, and each color stands for a specific thing. And we're going to do a little poll to see which flower you would be choosing if you were joining our walk. So the orange flower means that you support the cause and you want to help the Alzheimer's Association find a cure. Yellow flower means that you are supporting or caring for someone who has Alzheimer's. That can be family or friends. The purple flower means that you have lost someone to Alzheimer's, and the blue flower means that you are living with Alzheimer's or another form of dementia. So if you can answer the questions in the poll and click on what flower you would be, we can kind of get an idea of what our audience is made up of today. Okay. So do we need to do this? No, we'll just wait.
Right,
Yeah.
we'll just wait for
Okay.
the.
We're waiting for the poll numbers to come up.
We have 16 out of 31.
We're still getting more results.
Yeah.
So
Okay, I think I'm gonna go ahead and end it. Anybody wants to submit their last answers?
okay, so can they see the poll results?
I can share them.
Okay, yes, if you want to share them, then you can see, fortunately, no one is a blue flower in this group, so that's good news. The other percentages are pretty close. So there's 41%, 9 of 22 people know someone or lost someone to Alzheimer's. 8 out of 22 or 36% are caring for somebody, either family or friend. And 45%, 10 out of 22 want to support the association and the cause. So we appreciate that. And the next thing that we have is I want to explain a little bit. People say Alzheimer's, you know, my person has Alzheimer's, but there's a miscommunication or a misunderstanding. So Alzheimer's is one type of dementia, and it affects your mental ability and your memory and causes a decline in those areas, which then impact your daily life. So Alzheimer's is a specific disease, and it's one of many types of dementia. Dementia is the general term that describes the loss of a person's mental ability. So people use those terms interchangeably, but that really is not correct. So Alzheimer's has become the most common cause or form of dementia, with 50 to 70% of people being diagnosed. There's 3 specific types: late onset, which is the most common form and affects about 50% of people age 85 or older. And then there's early onset, which is affecting people under 65, or the familia, which is the rarest form, and that's the genetic form that affects 1 to 2% of the population. So a lot of times people, say, oh, I have Alzheimer's in my family, I'm going to probably get it. That's not necessarily true. It's not a genetic related disease. So through years of research, the Alzheimer's Association has come up with some causes that they know. So it's hard to find a cure unless you know the cause. So they're working a lot on the causes. So they've found that it's a combination of genetic, lifestyle, and environmental factors that affect your brain over time. Less than 1% is caused by specific genetic disease changes that might cause a person to get this disease. The risk of developing Alzheimer's or vascular dementia can be increased by the same conditions that damage your heart and your blood vessels. These include heart, diabetes, stroke, blood pressure, and cholesterol. So before we continue with anything further, we want to do this quiz. And can you put the quiz up? And then people can answer the questions on the quiz.
Sure.
I blew that.
That's okay. It works. All right, so here's our first question. This is Kim. So red wine and grape juice can help reverse Alzheimer's. This is true or false? So looks like you guys already answered, and you guys, more people want to, I'll wait until people keep answering here. All right, looks like we're pretty good. Looks like a few more coming in. All right, and the correct answer is false. So no, there's no vitamin, supplement, food, or drug that has been shown to cure or treat Alzheimer's. So researchers suggest your best bet is a diet rich in fruits and vegetables, fish, and nuts to help protect your brain, but there is no silver bullet. All right, question number 2. So do we know, what do you know about Alzheimer's disease?
There we go.
Oh, okay, here's question number, well, is that question number 2? Yeah. I
I
guess.
was going to show the answer.
Okay.
Yeah.
Which of these raises your risk of Alzheimer's? So age, a flu shot, or aluminum cans? And we're getting most of the folks answering here. All right, so let's go ahead and with, you guys are correct. I knew you guys would be a smart bunch being an OLLI group. So age is the #1 risk factor. So the older you are, the more likely you are to get Alzheimer's. So the actual cause isn't fully known. The list of things that don't cause dementia include aluminum cans, cooking pots, flu shots, artificial sweeteners, and silver dental fillings. All right, let's go to question number 3. Okay, if one of your parents has Alzheimer's, you're probably going to get it. Is this true or false?
Yeah, okay.
All right, and Lynn mentioned this earlier, and you guys are correct that said false. So less than 5% of cases run in families. So your genes do play a role, though. If you have a parent or sibling with Alzheimer's, you do have a higher chance of getting it. All right, move on to question number 4. So when does Alzheimer's start? Within 1 year of your memory loss, about 5 years before your memory loss, or about 20 years before memory loss? So when does the disease start? It's good. We're getting lots of different answers here, which is good. All right, and the correct answer is actually 20 years before memory loss. So repeating yourself, getting lost, showing fuzzy thinking skills all show up after the process of Alzheimer's has already begun in the brain. So researchers believe the disease may start to cause physical changes years or decades before symptoms appear. All right, we'll move on to question number 5. So what are the odds you'll get Alzheimer's if you live to 85? Is it 50%, 75%, or 100%? If you live to 85, what do you think your odds are? All right, and you guys are correct again. It is 50%. So Alzheimer's is not part of the normal aging process. Even though we said age is the #1 risk factor, just because you get older does not mean you're going to get it. So most people who get it are over 65. Your risk doubles every 5 years after age 65. Nearly half of 85-year-olds don't have it. However, it can also start younger. Among those with younger onset Alzheimer's, a rare inherited form, symptoms start as early as age 30 to 50. All right, we have our next question. Got 2 questions left here. So what protects your brain more? Learning a new skill, doing the morning crossword puzzle, or playing a weekly computer brain game? All right, and once again, the bulk of you guys are right, 98%, 96. So learning a new skill. Experts don't know if doing mental work can prevent Alzheimer's, but it may help build brain power that helps you hold off memory loss. It's better to learn new things than to fall into old habits. It's also better to work out your brain every day. Also, key to protecting brain health, daily exercise, and a busy social life. So it's fine to do the daily crossword puzzle, but they really want to emphasize, try to learn something new. And as you guys are doing, taking all these OLLI classes. So, all right. And our final question in our quiz. So who spends more money on Alzheimer's care? Is it live-in caregivers, local caregivers, or long-distance caregivers? Who spends more money? All right, looks like we've got pretty much all the answers in there. All right, and the answer to this is long distance caregivers actually spend the most money. So those who live more than 2 hours away from a loved one with Alzheimer's spends almost $10,000 per year on travel, phone, and paid helpers. That's almost twice as much as those who live locally. Local caregivers put in more hours though. All right, thanks for taking the quiz. We're going to move on to Lynn with the 10 warning signs.
Well, actually, we're going to back up a little bit, and I'm going to go into a little bit further explanation of what the association knows actually is some of the causes. So they have discovered through a lot of research that there are 2 proteins that if you get an abnormal buildup of these 2 different proteins in and around your brain cells, one of them is the amyloid, and amyloids form plaques around the brain cells, which then enable those cells not to function properly. The other protein is called tau, and tau deposits around in your brain form tangles within the brain cells. These proteins can now be detected by a PET scan. However, you can have plaques and tangles and not have Alzheimer's, or you can have Alzheimer's and not have any evidence of plaques and tangles. So that alone makes it such a difficult disease to try and diagnose. And again, even though they have these indicators that, you know, you could be having this disease, still the ultimate answer to whether you do or don't have Alzheimer's is unfortunately after the person has passed away and they do a brain autopsy. So they know that the hippocampus, which is the lower part of your brain, tends to shrink. And as that shrinks, it affects the different areas of your brain for your different functions, your memory, and Kim will go into the different stages a little bit later. One of the other things the Alzheimer's Association has come up with is a list of 10 warning signs. And are we showing that slide now? There you go. So everybody has some form of memory loss at most of our ages. And I've heard this time and time again. It's like, oh, I can't find my keys, or I've lost my glasses, or I misplaced my grocery list. I must have Alzheimer's. That is not true. That is just a normal process of aging where you sometimes forget, or you're sidetracked. Maybe you're trying to do 2 or 3 things at the same time, and then you just lose track of where you are. The difference is if these memory losses totally impact your life and affect your daily living. So say you lose your car keys and you are looking for them and you don't really know why, and then you find the keys, but you don't remember having a car. So that you have to be real careful in that, and don't diagnose yourself just because you forget something once in a while. The second warning sign is challenges in planning or problem solving. I mean, sometimes, you could be cooking and you're reading a recipe and then you're like, did I do that? Did I not do that? There's little things that we do all the time in our daily lives. They are not an indicator or a warning sign for Alzheimer's. However, a typical trouble is if people living with dementia experience changes in their ability to develop or follow a plan or to work with numbers. So they may have trouble following a recipe, keeping track of their bills, and difficulty in doing everyday tasks. So the third warning sign is difficulty completing familiar tasks. So we all have our routines, and sometimes we get discombobulated and get out of our routine. That is, just an occasional age-related change. Like maybe you can't remember how to set the clock on your microwave and you have to get the directions out. That's not an indication that you're getting Alzheimer's. People living with the disease find it hard to complete routine tasks. They may have trouble driving to a familiar location, making a grocery list, remembering the rules of a favorite game. Those are more inclined to be a warning sign. Confusion, number 4, confusion with time or place. I know since I've quit teaching, sometimes I lose track of what day of the week it is. And that's not a sign that I'm getting dementia. It's just I'm not focusing. People living with Alzheimer's lose track of dates, seasons, passages of time. I'm sure you've all seen the ad on TV where they're interviewing the gentleman and he can't remember what season it is. He can't remember that it's fall, but he knows it has something to do with leaves. That's a warning sign. So you may forget where you are or even how you got to where you are. The 5th warning sign is trouble understanding visual images and spatial relationships. We all know as we age, our vision changes, and a lot of times those changes can be directly related to cataracts. However, a person having specific vision problems, leading with difficulty of balance, trouble reading, these can tend to be warning signs. Sometimes they may have problems judging distance, determining a color, or contrast, and those can cause issues with driving. So number 6, new problems with words in speaking or writing. It's quite typical. Sometimes you'll be talking to somebody and you can't remember a person's name right at the tip of your tongue, but 2 or 3 minutes, 5 minutes into the conversation, you suddenly remember their name. That's not a sign of Alzheimer's. People with Alzheimer's have trouble following or joining a conversation. They may stop in the middle of the conversation and have no idea to continue, or they keep repeating themselves. They struggle with vocabulary, have trouble naming familiar objects, and often use the wrong name in naming familiar objects. Those are warning signs. Number 7, misplacing things and losing the ability to retrace your steps. Again, I think we've all had experiences where we've misplaced something, but a person with Alzheimer's may put things in unusual places. They may lose things and be unable to go back over their steps to find them again. And they may be accused of stealing. They accuse people of stealing things. That's a real common warning sign is, okay, you stole my car keys, or you stole my, my bracelet that I, left on my dresser and now it's gone and they've stuck it in a drawer. So that is a warning sign. Number 8, decreased or poor judgment. Sometimes we all make a bad decision or make a bad choice once in a while, but that doesn't mean we have dementia. People who have Alzheimer's experience changes in their judgment or their decision-making process. They may, lose their ability to handle money right. They are spending money in a way they've never done before, like some of the scams that are out there for seniors, that they're always trying to go after seniors and try to scam them with different things. They may pay less attention to grooming or to keeping themselves cleaned and bathed. That's a real indicator. Number 9 is withdrawal from work or social activities. Their mood changes because they don't feel comfortable. They can't hold a conversation or keep a conversation going. They tend to withdraw. Friends ask them to go someplace and they always make excuses and they don't want to go. They quit doing their hobbies or their normal social activities. They have trouble keeping up with their favorite team. If they follow a baseball team and all of a sudden they've lost interest in it, that can all be a warning sign. And the last one is a change in their mood or personality. People can become confused, suspicious, depressed, fearful, or anxious. They may be easily upset at home, with friends, or when out of their comfort zone. So what do you do if you have a family member or a friend that you notice some of these changes? You need to talk to them, voice your concerns, and try to get them to go see a doctor. Therein comes another problem because we don't have a lot of doctors here in our area that can specialize in diagnosing Alzheimer's or dementia, but you need to be persistent. And we, meaning the Alzheimer's Association, is working with the medical professional field, trying to get doctors to be more forthcoming, doing some of the basic little tests that they can do, like you see on TV. And if they suspect the person might have Alzheimer's or another form of dementia, referring them on to a neurologist or another level of physician that specializes more in that care. So does anybody have any questions or anything about this as we go? Okay. Lewy body is a different form of, is another form of Alzheimer's. And again, it can't be conclusively diagnosed until they do a brain autopsy. And then let's see, has there been an increase in occurrence of Alzheimer's due to the imposed isolation of the pandemic? The studies now are showing that that is probably a yes answer. Social isolation is not healthy for anybody, and it's even worse for people with dementia. Anything that disrupts their routine can just throw them into a tailspin. So yes, the pandemic, not being able to see family has been especially hard on all of our senior citizens, especially those in care homes.
And I think that's it.
Any other questions? Okay. So we've done the warning signs, and now Kim's going to talk a little bit about the 7 different stages of Alzheimer's.
All right, so we'll move on to this. And all right, so the guideline, the 7 stages, this is used by professionals and caregivers around the world to help identify at which stage of the disease a person is in. So you have stages 1 to 3, where these are pre-dementia stages. 4 to 7 are dementia stages. And then stage 5 and above, that's to the point where the person can no longer live by themselves without assistance. So, and then I'll go through the stages. Stage 1, there is no dementia seen with stage 1. So we call these mentally healthy persons at any age. When you get to stage 2, these are age-related forgetfulness. So many people over the age of 65 complain of cognitive or functional difficulties. Research has shown that this stage lasts 15 years in otherwise healthy persons. Then we get to stage 3, which is MCI, or mild cognitive impairment. So a person with MCI may noticeably repeat questions. So for people who are still working, job performance might decline at this stage. So MCI persons who are not employed, but who plan complex social events such as dinner parties may decline in their ability to organize such events. This may be an early stage of Alzheimer's. However, it's important for the person to seek medical help as soon as possible to determine if a medical condition might be causing or contributing to the person's difficulties. We had a gal that used to be in our committee that was told she had Alzheimer's. So she got her affairs in order and was like, okay, this is happening. And then they after she kept going to doctor appointments over and over again, they realized when with their husband that actually she didn't. It was a medication she was taking. And then it was actually her husband that was diagnosed. And so she became his caregiver. So it's really important to check it out. I know it's scary to go in and even pose that question, but it may be something else and not necessarily a form of dementia. So blood tests and MRI of the brain should be obtained to assist in determining if the individual has MCI due to Alzheimer's and whether there are other causes contributing to the person's cognitive decline. So with MCI, not everyone who is diagnosed with MCI will eventually get Alzheimer's, but everyone who does develop Alzheimer's will go through the MCI stage. So the average total duration of the MCI stage in otherwise healthy persons is 7 years. All right, move on to the next slide. So mild dementia. So the diagnosis of Alzheimer's disease can be made with considerable accuracy in this stage. The most common functioning deficit in these persons is a decreased ability to manage activities of daily life. This may become evident in the form of difficulties in paying bills, the inability to market for personal items and groceries, or order from a menu in a restaurant. Symptoms of memory loss also become evident in this stage. The person withdraws from participation in activities such as conversations. The duration of this stage is 2 years in otherwise healthy persons. And my sister-in-law's mom just went through this. So she came up to me a couple years ago and said, I'm sorry, I'm not participating in the conversation. She said, but, I can tell that, I can't keep the train of thought going. And she said, I'm probably a couple years out from, and she was pretty right on where she was in the stage. She hadn't been diagnosed yet, but she self-diagnosed herself. So, all right, we'll move on to stage 5, which is moderate dementia. So in this stage, the person with Alzheimer's disease can no longer now manage on their own. There is generally someone who is assisting and providing them food as well as making sure their bills are paid. Common reactions from person at this stage are often behavioral problems such as anger, and they get very suspicious, like Lynn mentioned earlier, like they think maybe folks are stealing from them or their spouse is having an affair. Persons at this stage frequently cannot recall major events and aspects of their current life. In otherwise healthy persons, this stage lasts an average of 1.5 years. Then we move on to stage 6, which is moderately severe dementia. So at this stage, the ability to perform basic activities of daily life become compromised. Persons begin to require assistance putting on their clothes properly. They lose the ability to bathe without assistance. They have problems with daily hygiene, such as properly brushing their teeth. They lose the ability to manage independently and the mechanics of using the toilet. And as the disease evolves in this stage, the person becomes incontinent. The person will at times confuse their wife with their mom or otherwise be uncertain of the identity of close family members. At the end of this stage, the ability to speak begins to break down. Emotional changes become most overt and disturbing. Persons may begin to fidget, to pace, to move objects around, or engage in inappropriate activities. They develop a fear of being left alone, and the duration of this 6th stage is approximately 2.5 years. And then we move into the last stage, so very severe dementia. At this stage, persons require continuous assistance with basic activities of daily life for survival. Once speech is lost, the ability to be independent is lost. In persons with this stage who remain alive after 1 year, they will lose the ability to sit up independently. lose the ability to smile, and lose the ability to hold up their head independently. They will also become rigid. Most persons die during the course of this stage due to pneumonia or other conditions. All right, we're going to now, if you can stop sharing our slides, and Nor will go ahead and she's going to share her slides for her part of the presentation.
Should we see if we had any questions first
Yeah.
before we go on?
Click it again. There we go.
Okay.
You do have some questions.
Yes, I see that.
chat.
So let's see, I'm trying to go up here. Let's see.
So
Yes,
I think
okay.
right here with Jane.
So right here with the, while the answer to the quiz was learning something new every day benefits you a lot, it certainly still benefits you to do brain games or other games because it keeps you engaged and it's keeping your brain functioning and moving. So that still is an important thing to do. Doing a puzzle. Puzzles are really good because they're using eye-hand coordination. You have to think, you have to see the shape, try to find where that shape goes. Anything that's a manipulative kind of activity that also engages your brain. Dancing is a great activity. And if you are a dancer and you're dancing, you know, sometimes there's always new steps or new moves that you can use and learn. So that's another really good way to keep your brain active and healthy. And then what are the medications that can stimulate dementia? You mean that can cause more dementia,
Or
Jane?
make it look like it's like they have dementia as opposed to when they don't. So
I said simulate. I
Oh,
mean,
simulate,
yeah,
I'm
yeah.
sorry.
not stimulate.
Sorry,
Okay.
simulate. Yeah, I'm having trouble seeing this too today. So I'm not real sure what medications there are that do that.
mimic it,
I know
yeah.
they have a list of medications that like, for example, Valium or lorazepam or those, you should not be on those for extended periods of time. I believe you could go to the alz.org website and Google medications. Their website has a wealth of information on just about every single topic imaginable, but right off the top of my head, the only one I know is certain antidepressant medications are not healthy to be on for long periods of time. And then let's see, we had a friend that had memory problems, tried starting statins when she quit, the problems diminished. Yes, that is sometimes a problem too, that medication can cause you to mimic some of the symptoms of Alzheimer's. That's why it's really important if you start, you know, having any of the symptoms or side effects, you need to notify your doctor right away. And as always, you should always check with your doctor when you stop a medication. Some medications, it is not healthy to stop them cold turkey. You have to kind of wean yourself off of them. So please refer to your physician if you're having any concerns about that. And again, your question, Jane, they do know that anesthesia and those types of dementia do interfere with a person's thought processes and can cause, you know, the symptoms to be more prevalent. We can refer to Bob Durfee, who was on our walk committee. He passed away last year and he ended up having to have a pacemaker put in. He was taking one of the medications to kind of slow down the progression of Alzheimer's, and he had to quit taking that medication before his surgery. And then of course he had the anesthesia and was on, you know, some medication afterwards. And he was totally discombobulated. He didn't recognize his wife. His speech was garbled. He couldn't put his thoughts together. Once he got off of all of that medication and the anesthesia had gotten out of his system and he was able to go back on the medication that was helping him, he returned to his former state. So that is a big concern with anesthesia and certain types of that medication. Again, you need to make sure that if you have to have any kind of surgical procedure or procedure that requires anesthesia, that you let your doctor know that that you have, you know, some of the early signs of dementia, so that you need to be upfront and let them know so they can figure out the best course of action for you. Okay, so thank you for the website there that somebody just put in the chat that can cause memory loss. Okay. And then Jeannie commented that it's unusual, it's a usually a mixture of medications that cause dementia. Okay, and then again, thank you, Joseph, for that website on the medications. Okay, any other questions before we go on to Nor? All right, Nor, you're up.
Hi, everyone. My name is Nor Shepherd, and as the introduction said, I had been the coordinator for the Healthy Brain Initiative at Shasta County, and now live in Trinidad. So thank you for having me here today. It's been a couple months since I've presented, so I might be a little rusty, but here we go. So we've talked about, or Lynn and Kim have talked about the different stages of Alzheimer's and dementias and things that may cause dementia and Alzheimer's. And as with most diseases, there's always an interplay of genes versus the environment. And so while some people are predisposed to Alzheimer's and related dementias, we can reduce our risk and at least delay the onset or severity of the disease and still live a healthy life. So getting the diagnosis, I just want to say, isn't the end of or the end of the possibility of living a good life either. But these are a few things you can do to reduce your risk. I know we've kind of touched on these already in the last hour, so I won't go too much into detail or repeat what's already been said. But the biggest thing you can do is take care of your heart. So brain health is very much connected to your heart health. Your heart pumps blood to every part of the body, including the brain. So damage to blood vessels can lead to heart attacks, strokes, and vascular dementia, which is one of the most common causes of dementia. And heart attacks and strokes happen when there are clots or plaques blocking blood flow, or when the blood vessel in the brain has burst. And dementia can start to happen as a result of a series of small or silent strokes or mini strokes in the brain, leading to memory loss, slowed thinking, and personality changes that happen, as Kim mentioned, can happen, start 20 years before symptoms are really noticeable. So taking care of your heart is crucial to taking care of your brain. This includes managing your blood pressure, keeping track of your blood sugar levels and diabetes, and controlling your weight, as all these things can put a strain on your heart and then on your brain. Second kind of category is exercise and diet. Exercise is shown to actually reduce your risk by up to 40%, developing Alzheimer's and dementia. And that really what people recommend is at least 30 minutes for at least 5 days a week. But obviously doing more is beneficial as well. And when it comes to diet, I know there's a lot of fads and people believe various different things. There's always new articles and research coming out on what you should and shouldn't eat. And so as a basic rule, rather than saying Mediterranean or vegetarian or vegan, I'd like to tell people to eat whole foods and keep away from processed foods as much as you can. So that really just means incorporating more vegetables, fruits, and whole grains and legumes. And rather than thinking about things you shouldn't eat, sometimes it helps by just incorporating things, and that automatically cuts out the unhealthy things you might have been eating. And third category is social connections and intellectual stimulation. I know Kim and Lynn have already kind of gone over this, but I know somebody had asked how intellectual stimulation can protect your brain. Basically, when you're stimulating your brain, you are reducing brain cell damage, which happens, or at least causes Alzheimer's and dementias. Stimulating your brain also supports and promotes new nerve cells to grow, and it prompts and strengthens the nerve cell communication in the brain. So just keeping your brain, sharp and active really helps. And that can be from doing puzzles, as we've already mentioned, reading a book, even going on a walk or taking a new route, just small things in your day-to-day life that take you out of just the routine and encourage your brain to think in different ways. And then lastly, prevention also includes just basic choices and lifestyle behaviors. So if you're smoking tobacco, highly recommended that you stop smoking, reducing alcohol intake, and then protecting your head from injury. So simple things like wearing your seatbelt and helmet when necessary, reducing injury that can cause trauma to your brain, which can also cause Alzheimer's and dementia. And then I know there's some things that we cannot always control in the environment, and a lot of these are called social determinants of health. And these are the conditions and places where people are born, where they live, learn, work, and play. And these can have a profound effect on a person's health, including the risk of developing Alzheimer's and dementia. And differences in the social determinants of health can contribute to persistent chronic disease disparities in the United States among racial, ethnic, and socioeconomic groups by limiting opportunities for members of some groups to be healthy. Health inequities have persisted across generations due to policies, practices that have limited access to healthcare and other opportunities for people to be healthy. But there is a growing body of work that exists around social and economic factors that may contribute to a person's health status, including a person's risk for developing Alzheimer's and dementia. So there's 4 major areas. First one is education. So studies show that an association between a higher level of education is connected to better brain health. So for adults aged 45 and older, the proportion experiencing cognitive decline was lowest for those with a college education, and nearly 3 times greater for those without a high school diploma. And so one theory being considered by researchers as to why education levels may affect the risk of developing dementia has to do with cognitive reserve. And this theory suggests that basically the education and level of knowledge that we've banked in early years may protect and compensate for a decline of cognitive health in later years. And so they've used the level of education as a proxy measure for how much someone has learned. Obviously, there are people who have not gone to college, but who are continuously learning themselves at home. So it's not to say that without a college degree, you're gonna get Alzheimer's and dementia. It just means to say that if you are constantly learning throughout your lifetime, you are protecting your brain for years to come. Second point is access to healthcare. So access to healthcare affects many facets of a person's physical and brain health. Consistent access to healthcare services gives people the opportunity for regular preventive health services and early diagnosis of many health conditions, such as diabetes and heart disease, which can later affect your brain. Access can also prevent hospitalization through managing chronic health conditions. People with dementia often have one or more chronic health condition. Thank you. And then third one I wanted to mention is, which we've already kind of talked about, is loneliness and social isolation. So a number of studies indicate that maintaining strong social connections and keeping mentally active as we age will lower the risk of cognitive decline. They're not certain about the reason for this association, but it may be due to a strengthening of connections between those nerve cells, which we talked about, that you get from stimulating your brain. So it's hard to precisely measure social isolation and loneliness, but there is strong evidence that for adults aged 50 and older who are socially isolated, put their health at risk in many different ways. So studies have found that social isolation significantly increases a person's risk of premature death from all causes, rivaling the risk of smoking, obesity, and physical inactivity. It was also associated with about 50% increase in developing dementia. And poor social relationships were associated with 29% increase of heart disease and 32% increase of risk of stroke. Loneliness is also associated with higher rates of depression, anxiety, and suicide. I know somebody had asked how COVID has affected that, and I know it might be too early right now to tell for that research to be out there, but I'm sure, as Lynn said, that we will probably see those effects in studies, very recently or coming up. And I don't mean to bring up all these things to put a damper on everyone's spirits, but it's just things to be aware of, that we can try to control as much as we can, even in the midst of a pandemic. So just making a phone call, reaching out to people, attending classes such as these, all those things, are not only protecting how you or increasing how you feel, but are protecting your brain as well. And then lastly, I wanted to mention the built environment. So the built environment is the physical environment around us. So it includes where we live, our homes, our schools, businesses, even the streets and sidewalks, open spaces, and the options people have for transportation. These can influence overall community health and individual behaviors, such as encouraging physical activity and healthy eating, or discouraging healthy behaviors. So they can affect people's health both positively and negatively. And health community designs can improve opportunities for exercise, access to services, and community supports. Some of the work the Alzheimer's Association is trying so hard to do in this county, but also across the nation. And so I thought, since we're talking about built environments, I would like to quickly mention Alzheimer's and how global warming, or in more particularly air pollution, affects Alzheimer's and the risk of developing dementia. So both increasing levels of air pollution and increasing cases of dementia are worldwide public health crises. Air pollution is made up of several different components, including gases, chemical compounds, metals, and tiny particles known as particulate matter, or called PM 2.5. So long-term exposure to high levels of air pollution can be hazardous, leading to health conditions that can affect the heart and the brain. So most research has focused on the fine particulate matter, which are tiny particulates that are 40 times smaller than the width of human hair. So it's not necessarily pollution you will be able to see, but it's pollution that is measurable. So we've known for a long time that long-term air pollution exposure is associated with the accumulation of the Alzheimer's disease-related brain plaques, which Lynn and Kim mentioned earlier. However, now there's evidence showing that reducing pollution, especially that fine particulate matter in the air and pollutants from burning of fuels, is associated with lowering the risk of all-cause dementia and Alzheimer's. So improvement in air quality is associated with benefits to overall cognitive function and memory as well, suggesting a positive impact on multiple underlying brain regions. And these are studies that have just recently been conducted, were presented at like the national Alzheimer's conferences. And they've been conducted over the US, the UK, and France, just to mention a few countries. Another recent study, however, from the UK also showed that exercise was linked, as I've talked about, to sturdier brain health. However, men and women who lived in areas with better or lower amounts of air pollution were shown to have larger amounts of gray matter and low incidence of white matter lesions compared to people who never studied, which makes sense. So the more you exercise, the stronger your brain is. And those are, images and the anatomy that you can actually measure and see. However, they found that people who lived in areas where there is a greater amount of air pollution, no matter how much they exercised, their brain did not show any signs of improvement or protection against Alzheimer's and dementia. They repeated this study with another group and found the same results, which suggests that obviously this is very alarming, and it increases the urgency for developing more effective regulatory policies related to air pollution and air quality, which is another area that the Alzheimer's Association is working on and pushing our legislators to back those policies. So regardless of whether you believe in global warming or not, I think the science is out there to show that air pollution does exist and is affecting our brains. And so it's policies and science that will benefit everyone. That isn't to say that you shouldn't be exercising if the air pollution isn't great where you're living. There are ways to prevent the negative effects of air pollution, such as staying away from busy highways while exercising, if at all possible. Automobile exhausts are among the worst pollutants for human health. Air quality also changes throughout the day, so you can check your local conditions at airnow.gov. And that you can put in your zip code and it'll tell you how good your air quality is at that moment, which can determine if you want to get outside for exercise. Masking might also help, not just to prevent COVID and other diseases, but also to filter out those bad air pollutants when you're exercising outside. And most importantly, keep exercising. Exercise has multiple benefits for your cardiovascular health and your overall health. And we do not want to discourage people from being physically active. We just want to encourage better policies around reducing air pollution. And that was all my little short contribution to today. I will hand the presentation back to Lynn and Kim. Don't know if anyone had questions.
There are some issues or some notations in the chat.
Okay, I'm just looking through the chat right now. Somebody asked, what are ADRDs? That just stands for Alzheimer's disease and related dementia. What is the definition of cognitive reserve? So cognitive reserve is, when I was talking about, it's getting that education and learning early in life kind of creates a reserve that protects your brain later in life. So it's kind of a bank of information and learning that boosts your brain. And so I hope that answers that question. Does marijuana cause or is a cause of Alzheimer's? I don't know. I don't know if there has been enough research on that for me to give you a definitive answer. But I can always look into that and email, send an email to Humboldt or OLLI at humboldt.edu, I think that is.
Yes.
And see if I can find any research on that. I wouldn't feel comfortable answering that though without definitive research.
They're just starting to do research on marijuana. I just watched a special on Keat Nova that was talking about medical marijuana, and they're starting to do all kinds of studies to see the long-term effects on the brain. So there'll be more information coming out about that. Nora, can you address Jane's question further up? Can you explain how dementia links with or doesn't to delirium experienced by people who aren't in their normal environments? Do you know how that relates?
Let me see if I can find the question.
And it came in at 12:47, if that helps.
You haven't mentioned it, but a lot of people who are in the hospital or get moved to new environments, new homes, whatever, experience something called delirium. And it either exposes dementia that people already have because they're not in their familiar environment. But sometimes it goes away, sometimes it doesn't
Right.
very quickly or at all.
Yeah.
And we-
So delirium is one of those, so it's one of those things that doctors usually look out for when they are assessing if somebody has dementia or Alzheimer's. It's one of those things they want to rule out first, because you're right, somebody could just be experiencing delirium, or the delirium could be a result of Alzheimer's and dementia. So that's really for the doctor to do that assessment. Usually with delirium, it comes on suddenly and it's just, it comes and goes. Whereas there are usually other symptoms as well accompanying someone who has dementia. So it can be related, but it can also not. And so it's really important to get a checkup with your doctor. And that goes for a lot of things. That's one of the things I know we were working on in Shasta County to doctors to do more regular cognitive screenings, just as you do normal health screenings on your yearly wellness visit, because we're not just looking out for Alzheimer's and dementia, but all sorts of things that can be impacting your brain. And it's really important to talk to your physician about that and not be scared. A lot of things are reversible as well. But in the case that you do have Alzheimer's and dementia, or someone you love does, getting that knowledge and that care management plan ahead of time can be really helpful for later on. So if that answers that question.
Could you perhaps define what delirium is?
There's going to be an issue with this.
I guess I'm not a doctor, so I don't have a clinical definition of delirium just off the top of my head, but I know that it's not the same as dementia, and it comes. Sorry, Lynn?
I said, I think delirium, lack of sleep is one cause of delirium. It's not the only cause. Yeah.
Also the drugs you could
Right.
be on.
Right.
Look it up.
Well, and then somebody else has said, Sherman is saying that nano and microplastics are found in all human organs and tissues. That's probably true. So, and delirium, Ann Lindsay is saying that delirium can be short-term.
Or
Is
yeah.
short-term. So we know that medication affects different people in different ways, and we definitely know that any disruption in a set routine for somebody with Alzheimer's or any form of dementia just throws them for a loop. The successive routine, the repetitiveness provides them a sense of security and stability. So whenever that is interrupted, it can cause more anxiety and more stress that can exacerbate their condition. So, any other questions? Okay, Kim is now going to talk a little bit about clinical trials, and this is a way that you can help the Alzheimer's Association with their ongoing research. So Kim?
All right, and if we can have the slides back up and then just the comments and chat about Life Plan Humboldt, I think that is wonderful. So I'm thrilled that that's happening in our community. So, and everyone who's supporting it. So do we have our slides back? I'm going to talk about Trial Match. So Trial Match is a clinical studies matching service designed to provide a customized list of potential study matches to each user. So let's see, let's go down one more slide. There we go.
Okay.
So, and who can sign up for Trial Match? A lot of people think, oh, clinical trials, I have to have the disease. And it's people with Alzheimer's, as you see here, or other dementia, people that have no current concerns about their memory, referred to as healthy volunteers, people who are caregivers for someone with Alzheimer's or another dementia, anyone 18 or over. So I signed up every 3 to 4 months. I'll get an email, and it's very simple. It's usually some sort of test I can do on my computer to perform. I can perform. So if you're in a bigger city closer to a research institute, you might go in to help with the clinical study. But up here, we don't always have that opportunity, but we can definitely help contribute by signing up. So go to Trial Match. The next slide. And it gives you the information if you want to click down.
Is it this one?
The next one, yeah.
Yeah.
So it's
There we go.
alz.org /trial match, or you can call the number that's on the screen there. So, but it's a great way. The more and more volunteers and the more and more research we can do, the closer we will come closer to getting medications and finding a cure. So, all right, I'm going to turn it back over to Lynn.
Okay, so one of the things that we do locally is our walk, which is coming up on October 8th, and Kim's going to talk about that a little bit later. Someone was asking about the medication. If you go back to the slide that you just showed, there are some of the medications that are available to address some of the symptoms of Alzheimer's. Okay, and we want to go to the next slide. I can't see what that is. Okay. We'll just hold that one for a minute. So as I mentioned earlier, the Alzheimer's website, alz.org, has a wealth of information that covers a lot of different topics, and it's in both English and Spanish. One of the main things the Alzheimer's Association funds is a 24/7 toll-free helpline. This helpline is staffed by specialists and master level clinicians that can answer questions and provide support. That number is 1-800-272-3900. They have a bilingual staff that speaks over 200 different languages. One of the things that we're working on right now is distributing the various brochures that we have throughout the county. We do this at public events, at Farmers Market, Arts Alive, 4th of July celebrations, speaking to groups like OLLI. We've been speaking to groups around the community. And we've just now partnered with United Indian Health, and we'll be working with them to get the warning signs and some of the different information out to our indigenous population of all the tribes in Humboldt and Del Norte County that are connected to Indian Health. And so one of the things that has become more prevalent as a result of the pandemic is the wide disparity in medical care and medical knowledge that our underserved populations have. So if you're not familiar with what the term underserved population means, it would be our African American population, Native American, Pacific Pan Asian, and LGBTQ+. So those are areas that we're kind of working our way through. We've been doing this with several of our local Hispanic groups for almost a year now, getting our brochures and information in Spanish to them. We've been doing that through American Express and several different organizations. So we're working our way through the groups. And if you need any information, or any of you that are on this OLLI class today belong to a group and would like to have us come and do a presentation, we've modified this one several different times to fit your needs. Please feel free to contact us, and we'd be happy to come and make this presentation to your group. The more people we can reach, the more knowledge that is out there, the more valuable it's going to be to help all of us. So here's just a little idea. If you make a donation to the Alzheimer's Association, oh wait, let me back up a minute. So the Alzheimer's Association is the leading global voluntary health organization providing care and support to individuals and families suffering from Alzheimer's. We are the largest nonprofit funder of Alzheimer's research, investing $250 million to more than 750 projects in 39 countries around the world. So when you donate to the association, you're not just helping fund research in the United States, it's all over the world. When you do donate, here's a little bit of a breakdown. $20 will help offset the cost for one family member caring for someone with Alzheimer's to attend 3 support group meetings. And support groups are a lifeline for caregivers. Something we haven't mentioned is that caregiving is very stressful, and the statistics are rather frightening. It's something like 80% of caregivers develop health issues, mostly heart, and some of those caregivers, a big percentage of them sometimes pass away before the person they're actually taking care of. So we're also reaching out to try to provide support for all of the local caregivers in our community. Between Humboldt and Del Norte County, we have approximately 3,000 people who have currently been diagnosed with Alzheimer's or a form of dementia. So a $100 donation helps offset the cost, or $100 helps offset the cost of an intensive one-on-one family meeting with a master level clinician. This could be just to address specific concerns, to help them develop a plan to navigate through the different stages, to get legal affairs in order, to get a support system set up, anything that that family needs. $200 will help offset the cost for 50 individuals to attend an hour-long workshop covering the 10 warning signs, difficult behavior, or other specific topics that they need more help and support on. So locally, we do our fundraising. We have the Humboldt Senior Resource Center has an Alzheimer's Adult Day Healthcare Program. So does Mad River Daycare has one in Arcata at Mad River Hospital. The Area 1 Agency on Aging can be a great resource. Redwood Caregivers is another group that you can contact. And Redwood Caregivers can help with respite care. The Alzheimer's Association has a grant process where you can apply for $1,000 in respite care. It's a one-time grant. So if anybody is interested in that, we have that information in that form and we can get that to you. And then North Coast Neuropsychology. Kim, do you want to talk about this?
Yeah, this is in Arcata. So the gentleman, he moved up to Arcata, I think 3 years ago now. He worked with the Alzheimer's Association when he was in San Diego. So, and he has definitely been able to diagnose some folks, and then they've gone down to the Bay Area to get to confirm their diagnosis of Alzheimer's or other dementia. So, and then he's been referring folks back to me, which is great. So I can let them know about the local resources in the community. So.
Okay. Anybody have any questions about local resources that are available?
Yeah, who are you talking about that moved up here from San Diego? What's the name?
Dr. Levine it is. So
He's in Sunnybrae?
He's in Sunnybrae, yes, with the North Coast Neuropsychology. So, and he'll, you can make an appointment with him and he will do different tests to determine if you're if you're likely candidate to have the disease. So.
Thank you.
You're welcome.
Okay. All right, you want to talk about
All
this?
right. So, so my role as a community engagement manager for the Alzheimer's Association, is to educate the community about Alzheimer's and other dementias, which we are doing today. And we've done on other occasions, retired teachers down in Fortune with the Garden Club, Rotary groups. My role also is to provide support and resources for those with Alzheimer's and other dementias. So at least once a week, I will get a call from someone in the community, all sorts of people. I get a lot of calls from men in their 80s who are the sole care provider for their wives. They're at home taking care of them, trying to do the best that they can. And so it's just heartbreaking. It's just, I'm glad that they're reaching out. So I try to put them into touch with whatever resources that they will be helpful to them. So. And then my third role is to
Oops, back to the other slide still.
Yeah,
We lost it.
Third role is to partner with the volunteer committee to plan and execute the Humboldt County Walked into Alzheimer's, which we will be doing this year for the 6th year. So we had, let's see, four in person, two virtual. So this year, I guess will be the 7th year. So we'll actually be hopefully keep your fingers crossed that we can meet in person this year. So, and then if anyone on this call wants to get involved, you can join the planning committee. We have a great group of people. Here's our different committees that are listed on the screen. You can start or join a team, recruit your friends, family, colleagues to join you in the efforts. Free registration, unlimited team size. There's no financial commitment. We like folks to raise money if they can, but if they don't, that's okay too. So you can text, it shows there ALZ Walk to 51555 or go to our website. We're always looking for sponsors, anywhere from $250 to $5,000. You can volunteer the day of the walk. which is, it's a really uplifting event. So I know folks in the past, some people are like, well, that sounds depressing, but it's actually not. So we provide a lot of hope, and the folks that have been diagnosed are thrilled to see that the community is out there supporting them. So, and if you have any questions, my contact information is on the screen there.
What is
All
the
right.
date of the walk?
I should put that on there. I think I keep forgetting that, Jane. So it is October 8th. So we always do it the second Saturday in October. So it's at the Adorney Center. It's a nice, quick little event. Show up, register at 9 if you're not already registered. We do an opening ceremony at 10 for half an hour, and we go for our walk and back to the Adorney Center, do a closing ceremony, and you should be on your car driving away around 11:30. So.
And there's 2 walk routes. There's a short one and a longer one.
Is a mile or 3 miles, and folks have said, hey, I can't walk, but I want to support the effort cause. That's great too. So, you know, the walking, it's fun to be out there. We give flowers to everyone who show up, as we mentioned at the beginning of the presentation, according to what your relationship is to the disease. So if folks have their flowers, they can plant them, they can carry them, they can take them home. So it's just it's a nice event.
And when we had to go virtual 2 years ago, I don't even remember who came up with this idea. We started doing our promise gardens in various communities throughout the county, not just here in Eureka. So we've done them from Scotia, Rio Dell, Fortuna, Hydesville, Eureka, several different places in Eureka, the courthouse, Visiting Angels office, the Elks Club, Blue Lake, Arcata. Last year we had a live promise garden with live flowers in the 4 colors. And Joanne Conselman headed up a group of volunteers that took care of that. And we had gardens up in Trinidad. So, and that was kind of a fluke how that happened, but it's turned out to be really great because it's gotten those communities more involved. And a lot of times people in those communities will meet in their little groups, walk, carry their flower, and then end up at the promise garden in their community and plant their flower there. You can also write a special message on your flower. A lot of times people carry a photo of the person that they're walking for if they've lost somebody or know somebody with dementia. So as Kim said, it's a terrible disease, and it just wreaks havoc on family life, but the walk is truly a really uplifting event. So if you're interested in having an event that will give you hope and inspiration, the walk is the place to be on October 8th at the Adorney Center. Another way that you can join and help the Alzheimer's Association is through AIM. That's the Alzheimer's Impact Movement. And I will send a form to OLLI that they can send out to everybody that's registered for this class. It's a $20 fee every year. It is not tax deductible because AIM is the legislative lobbying group for the Alzheimer's Association. So when we ask for money, like this year, we asked for a huge amount of money. It was $280 million, which is now working its way through the federal legislature. That is in connection with the National Health Institute. That's the amount of money that they've told Congress they need to keep their ongoing research. So the Alzheimer's Association specifically is not asking for that money. We're asking Congress to support NIH's request for that money. And then one of the other bills that's going through is a bill to, and Nora was involved with this over in Shasta County. We all know how stressful it is for first responders when they're, police or fire or responding to an emergency situation. And this bill is to provide training so they will recognize somebody who has dementia. For example, if, there was just a recent show on or something on TV that they stopped this gentleman, he had dementia and he could not comprehend the directions that the officer was yelling at him and telling him to do, like, put your hands over your head or whatever. So that bill would provide specific training for police and fire first responders to help them recognize the signs of dementia and some different tactics and approaches to take with dealing with people that are in that stressful situation. So again, if you'd like to make a donation, we'll put up that information. As we mentioned, Jeannie is on the site here, or she's our captain for our Visiting Angels team. And thanks to the tremendous support from our community last year, our team raised a little over $50,000, which in turn gave us a $50,000 bonus from the CEO of Visiting Angels. So altogether, the Eureka Visiting Angels team was the top fundraiser. And we just can't thank people enough for their support. And we hope that you will help support us again this year. We'll take some as UCSF.
All right, and then we can go to the next slide. All right, for Alzheimer's Association brochure, you can email Lynn. Here's her email address up here, or go to the Alzheimer's Association website link. And I think
We have a
Give
list
that
of,
to
yeah, we have a list
OLLI.
of brochures that OLLI is going to send out to everybody that's participating in the class. So if you would like, that information, please reach out to us and we'll get it to you. Again, the more people we can educate and get this knowledge out, and the more you can share it with your family and friends, the more it's going to help all of us. So are there any other final questions, comments, anything else that we can address?
This has been absolutely wonderful. I think this has been a great presentation, very informative. I think the extent of questions has been great. And I think that you're going to find a lot of people are interested in participating in the events to come. So thank you ever so much, all three of you. And I hope you have a very successful event on October 6th.
Not April. We're not ready.
Yeah, not April. We passed
We're
April
moving
6th.
on.
Well, maybe we'll do it twice next year.
Yes. Again, we hope that you were able to get the information. This isn't quite the way we had rehearsed this presentation to go, but as we all know, technology is wonderful when it works right, and it's the pits when it doesn't. So we hope that you were able to get some knowledge and understanding, get some questions answered, and we thank you for your time and look forward to seeing you at one of our events and helping support our cause.
Well, I think you'll get a lot of response.
Thank you so much for letting us present this again, Jane. We appreciate
Well, we're
it.
delighted. Each time it's been different, and each time you add more to it and more substance to it. So I think it's fantastic.
Yep, more and more research and more knowledge is coming out, and we want to share that with everybody.
And we really appreciate your sharing it with us. And I want to let you all know that next week on May 2nd, we're going to get an update on Life Care Humboldt, which is the Senior Life Plan Community Development. And Ann Lindsay, of course, who's president, will be presenting an update on where they are. And I think they have now closed in on the property. So come and learn more. And thanks ever so much. We look forward to seeing you next week.
I wanted to see who else. It's my girl, that's Mark's godmother from Morgan Hill.